Hi, this is Corinne Cavander, the Behavioral Health Operations Coordinator at Tri-County Health Network. Welcome to another edition of Mental Health Matters Access Show here at Codo. We are hosting the shows on the third Wednesday of every month on Codo to highlight resources and programs available in our community surrounding mental health. Interviews will be posted on our website following the broadcast at tchnetwork.org. We're excited to have you join us today. Thank you to the Codo News Department and Ben Kerr for making this possible. For this segment of Mental Health Matters, we are joined by Shawn McDonald and Ruthie Boyd, local community members who live in Telluride. Thanks for being here, you guys.
Thanks so much for having us.
Thanks, Corinne.
So to start, will you both introduce yourselves and explain how you got to Telluride and how you like it so far?
Yeah, of course. So this is Shawn. I'm from Minnesota originally, but I was in college last spring when we went into lockdown, and I was just coming out of college. I needed a job, and I found a position at Tri-County Health Network that really excited me. And the opportunity to live in Telluride, not in a city, not feel like I was locked down, that access to the outdoors really was the selling point for me. And that's been what makes me want to stay here for the foreseeable future. It's just so great to be able to have the mountains right outside your door.
I am originally from Breckenridge, Colorado, and went to school at the same college as Shawn, and we actually knew each other in college. And we moved here without knowing each other. We're going to move here. But I came to Telluride similarly like Shawn to pursue a job with Tri-County Health Network and for the stellar access to the mountains.
Well, I'm glad to know you both, and I'm glad you're here to talk about mental health with me. We had discussed in one of our meetings last week how talking about behavioral health in a supernormal way and mental health in a supernormal way is really important. So I want to ask you guys what struggles you've noticed young adults face mental health-wise in our area.
You know, we certainly live in a unique setting, and while there are some really great things about this area, there are also a lot of challenging aspects, and some of them that I've noticed for young adults have been sort of a culture of individualism and competitiveness, lack of access to mental health care, just lack of resources to cover everyone maybe, and a lot of wealth disparity between working class and tourist and second homeowners. And also a big one I've noticed is sort of the transient nature of this place makes building relationships difficult. You might make a friend who then moves away, and so a lack of consistency sort of can make it difficult.
Yeah, absolutely. I've definitely picked up on those as well. The biggest one I've noticed too is just this sort of isolation, which I think leads to a lot of alienation for folks, especially young folks in the area. Not only is Telluride literally at a dead end on a road, but it's, the nearest cities you've got Cortez, Durango, Montrose. I mean, those don't offer a ton in terms of resources, whether that be resources just as social outlets or as healthcare resources, mental health resources. And for the ones that they do offer, sometimes if you're a seasonal worker and you're here in the winter, and your car doesn't have four-wheel drive, you might feel stuck in Telluride, which I think it's really easy then to feel like not only physically stuck, but then just mentally stuck in a place, stuck in a rut. I think that's also exacerbated by that, by what Ruthie was just talking about with Telluride's main focus is tourism. I mean, that is the economy here. And so if you don't feel like you're prioritized by your community, that's another level of alienation and isolation for sure.
Now shifting kind of inward, are there any personal struggles you guys feel comfortable with sharing that you've encountered since you've moved to the area?
Yeah, absolutely. I mean, as Ruthie and I both mentioned, we moved here in right in the height of COVID. I mean, it was just after everyone was coming out of the spring lockdown. And so moving to a new place is challenging as is, but with all the restrictions that we had with COVID, that was hard to try to try to meet folks and make those connections that I think are so important to mental health. For me in particular, I'm not from the mountains. This is my first time living out here. And so there is definitely a premium placed on certain activities or activities that are entries into the social life. So thankfully I had the financial resources to be able to buy a bike, to buy a ski pass. But for a lot of people, that's not an option. But even with being able to participate in those activities, it's still, well, after a year here, it's like, oh, I think finally I'm making some traction in the community.
I relate to a lot of what you said, Shawn. I think that one of the biggest struggles was finding ways to connect to the community in a time where a lot of these things that we've been going through aren't normal and no one's really ever experienced them before. So all of the worldwide changes, as well as kind of, at least for me personally, like a really new environment compared to the one that I'm used to in college, and a really new set of people and a new social scene, and sort of trying to navigate all of that in the midst of a really difficult year has definitely been a lot at times.
I think both those answers really touch on exactly the point of this show, is to show that these conversations are super normal, and going through these things are also super normal. So I'm sure there might have been times where you felt alone, but that whole community here was probably feeling the same thing, which to me is kind of cool. And if we're able to talk about it, then we're able to feel less alone. So, and then kind of to build
Absolutely.
off. Yeah.
I went camping with a couple of friends this past weekend, and we were all sharing these experiences that I think each one of us felt like was in some ways unique to us, but then we all just realized that we had very, very similar experiences, but we wouldn't have known that way. We wouldn't have known that had we not shared those experiences. So I think just talking about things, it helps you realize how universal a lot of the struggles here are, and realize that there is this larger support system than you think.
Absolutely. And then you don't have to pretend to be okay. You don't have to look when you're on Main Street at someone to be like, whoa, they have it so put together. When really, if they talk about it, they're probably going through a lot of the same struggles that you are. So yeah, thank you for sharing that. So kind of to get a little bit more broad here, what does mental health mean to each of you?
Gosh, it's a tough one. I think we don't often think about we use that expression so often, like mental health, but it's to really lock in exactly what it is. It might be unique to the individual, because I think it goes so much more beyond just like, oh, am I happy or am I sad? It's really this total body, total mind approach to well-being, emotional well-being, but social well-being. So yeah, that's for me at least. It's all the things that I do in my life that are going to help me not just kind of stay afloat day to day, but actually help me thrive in what I'm doing. And I think that I know I've often heard mental health compared to physical health, and that if you don't just focus on your physical health, like when you're at your worst, when you reach rock bottom. It's the same with mental health. Absolutely. It's, oh, every day I have to be taking time for self-care. I have to be surrounding myself with people that make me feel good and that I can be open with and share what I'm going through with.
Yeah, I think something that's always resonated with me that someone told me was that everyone has mental health, and not just those who are struggling have mental health. And I think that's really important to remember too.
I think both of you kind of nailed it. I mean, my outlook on mental health is there's, wellness and illness, just like with physical health. So, we're trying to maintain that mental wellness within each of us. And Shawn, you talked about a lot of those things we can do to maintain that, to help us thrive. But then there's also mental illness too, and it's all encompassed of that mental health, just like physical health. So, and Shawn, you were kind of talking about too, how you and a group of friends were able to discuss kind of maybe some of the struggles or mental health issues they were going through. But how do you guys think as a community we can normalize those conversations more? So normalize conversations about actually taking care of our mental health.
Yeah, I think that normalizing these conversations like we've been talking about is so important. And even though it might seem challenging to bring up these topics at first, you know, there's a lot of ways to sort of incorporate them into different settings in your life and not just hold them for that one space that's supposed to be like for talking about mental health. And I think that, Corinne, you do a good job of doing this, sort of incorporating talking about mental health into a lot of different parts of who you are and not just your job. And I think that we don't have to constrict these conversations to a certain setting, and camping is a great example of a good time to talk.
Yeah, absolutely. I think the most important thing is just to start talking about it. And, you know, that's much easier said than done. We're so in the habit of just kind of going through the motions, especially with day-to-day conversation, even with friends and family. It was funny. So Ruthie and I work together, obviously. And the other day I asked her about something, and the response was just, oh, it's okay, it's fine. Just because we're trained to respond to something, when the reality was, whatever that situation was, there was a more in-depth response. And so I think holding ourselves accountable to to one another and just, you know, asking those harder questions. I think one great thing that we have in San Miguel County is that Tri-County Health does offer like safe talk and mental health first aid, which even for us who work at Tri-County Health, it's a great way to learn how to ask those difficult questions, to just have it more that be a larger part of the conversation.
Thank you both. And yeah, with normalizing it too, I feel like these conversations don't have to be so heavy. Right now, I feel like people view mental health conversations as, whoa, this is going to be a therapy session. And like this person's going to unveil all of their trauma, everything that's happened to them. And it's just going to be this huge, massive deal. Where when you talk about your physical health, it's normally like if either of you were hurt, we'd be like, oh, what happened? How are you feeling? Do you need anything? And then likely move on. And I feel like that's kind of what we need for mental health too. So that way, you know, the times that we're struggling, we can maybe open up a larger conversation. But if we just need to quick be like, oh, I'm anxious, and have someone recognize that, that makes it super normal too, where it doesn't need to be this, you know, scary big convo. It can just be a, hey, this is where I'm at. So thank you.
Beyond the scariness of it too, I think there's just it's a heavy topic, but also there's a lot of stigma around, oh, I don't want to show that I'm suffering, especially in this mountain town too. It's like, you know, everyone wants to be the best at everything and like be the most able. And sometimes it's just, you know, it's we don't want to say, no, I want to take a break from skiing today. I just need to focus on myself. And while that's a very particular stigma to this community, I think there are a multitude of stigmas that are really tough to get over. But I think, as we were talking about earlier, just the universality of it is really so important to highlight that, no, so many people are going through this.
Why do you guys think the conversation we're having now and just broader conversations about mental health and suicide create better outcomes for our community members?
I think just continuing on with what we've been talking about, it gives a space for just bringing it up and just being exposed to the thought of having these conversations. It's not going to be like a switch overnight, like all of a sudden everyone's comfortable. And I think that if we can chip away at it conversation by conversation, we can make headway in helping people sort of have the confidence to start their own conversations about mental health in a variety of settings that they feel comfortable in.
Yeah, absolutely. I couldn't agree more with that. I think, you know, if Ruthie's talking about her mental health or she's talking about suicide prevention or awareness, I'm so much more likely to talk about my own mental health. And I think there's really that contagious effect to that, which is so important.
You guys are very insightful. So thank you for sharing with me today. And for all of our listeners, if you or anyone you know is experiencing suicidal thoughts, please call the Colorado Crisis Line at 1-844-493-8255. I also want to mention that May is Mental Health Awareness Month, so I encourage all of you this month and every month to talk about your mental health. Tri-County Health Network will be hosting a resource fair on May 24th from 2 to 5 p.m. in Elks Park with tons of local resources to prove to this community that no one is alone. We can't wait to see you all there. Join us on June 13th for our next edition of Mental Health Matters. And if you are interested in learning more about our behavioral health programs at Tri-County Health Network, please email us at info@tchnetwork.org or call our offices at 970-708-7096.